And now to set us on inspirational and key speeches in understanding what our agencies are doing for us, our institutions are doing for us. I'll ask first Martin Seychell, Deputy Director-General of SANCO, of the Direction of Health and Consumer Affairs, to give us the perspective from the Commission and SANCO. Thank you, Martin.
Honorable Prime Minister, honorable ministers, distinguished guests, ladies and gentlemen. I am indeed very pleased to have this opportunity on behalf of the European Commission to discuss with you some of the very important issues that are currently at the core of the European health agenda. Of course, in the European Union, public health remains to a large extent a national competence, and there is a very good reason for this. There are some very important specificities between and within the member states. But still, we should not overlook that there are many areas where it makes sense, or indeed it is even crucial, that the member states work together. And there was never a time when maybe this was truer. All across Europe, health policy makers face a number of similar basic challenges. We all have an aging population. We all face an increase in chronic disease. We all need to meet a great demand for healthcare. And, of course, the cost pressures which are coming from expensive, certainly effective, but often very expensive new technologies. The recent economic instability has put further pressure on the sustainability of health systems in a number of countries. And this is not a short-term problem. The situation is likely to continue as public budgets will almost certainly be constrained for a number of years to come. So the diagnosis, if I can put it in this way, is very clear. Public health budgets have been squeezed under growing pressure. The distribution of health professionals is inadequate. In some areas and countries, this is exacerbated by migration flows. Europe, as I said, has an aging population, and consequently, the need to deal with an increase in chronic diseases and multimorbidity. At the same time, patients, quite rightly, expect health systems to provide the best possible care. And therefore, particularly in times of crisis, health systems should be prepared to meet the needs of a population which is already experiencing poverty and social exclusion, and to prevent citizens from slipping into poverty because of healthcare costs. Poverty and health problems are very much interrelated. They both are a cause and an effect. And this is of great political concern as well. An opinion poll carried out in 2012, it was conducted across 170 European regions, showed that healthcare is the third main concern of citizens, just after unemployment and the overall economic situation. So our citizens clearly see health as a big issue, and big issues by their very nature merit a political response. We know from past experiences that in times of crisis, health outcomes and the risk of health-related financial hardship are greatly affected by any changes in the resources available for health systems. The current key challenge is to prevent the economic crisis from becoming a health crisis. As the effects of changes in gross domestic product and changes in spending on health are not synchronous, it will be some years before we clearly see all the effects the crisis had on health. It may be, certainly will be probably the case, that the effects of the crisis will persist long after the crisis itself or the worst of the crisis is over. Still, the seeds of the current problem were sown many years ago. If we look back already 3-5 years ago, even more, it is already true, even then, that the health systems already needed to become more resilient. Resilient financially, to protect them against the negative impacts of budget-driven reforms, but also operationally, as Josep just mentioned, to maintain and improve the efficiency, the accessibility, the effectiveness of healthcare. It is also now abundantly clear that not all health systems were equally well prepared for the recent challenges they had to face. Some were better prepared than others. Having said this, I am convinced that an approach for investing in health is needed, and member states have a strong interest to apply it. As the Commission has pointed out in a policy paper earlier this year, the approach of investing in health should have the following pillars. First, we need to invest in sustainable health systems, which implies innovation and reform to ensure that the twin aims of access to high-quality healthcare for citizens, but also a greater cost efficiency. These are twin and equally important objectives. Secondly, we need, as any investor does, to view investing in health as a human capital. Health of the population is our primary asset, particularly in a knowledge-based economy. It is not just a question of living longer, but also living in good health, because a healthy population is a productive population. And this is why we must also invest more in health promotion and disease prevention, as well as on training the necessary workforce. And thirdly, we also need to invest in reducing health inequalities. Health must be for all, not just for the privileged. We must strive to break the vicious spiral of poor health and poverty in order to achieve better social and territorial cohesion in the EU. The point of departure, as Commissioner Borch frequently emphasizes, is that health is clearly a value for itself. There should be no doubt about that. But it is also an area that will generate significant job opportunities in the years to come, and thus also contribute to economic prosperity and social cohesion. This is a key element to be taken into account in the EU's Europe 2020 agenda and in the European semester. The title of my intervention is Towards Modern, Responsive and Sustainable Health Systems. And as you know, this was the title of the Council conclusions which were agreed in Luxembourg in June 2011. Today, I don't want to be exhaustive, neither on the scope of those Council conclusions nor on the issues to be covered in this conference, but I will briefly address each of these dimensions of the health systems and explain where and how we should invest in health in each of them. First, our health systems must be sustainable. And there is a very good reason why this is very important. Healthcare accounts, on average, for 15% of EU government's expenditure, 15%. Before the economic crisis, health was among the fastest growing spending items for governments in almost all member states. This trend will most probably ease off. Indeed, several countries, in particular those most affected by the crisis, are actually cutting health budgets. Public health expenditure in 2010 was slightly below 8% of GDP. 30 years ago, it used to be 5.5%. On average, public health expenditure in the EU has been increasing faster than GDP from 2006 to 2011. But even then, even during the same period, even before the worst of the crisis happened, we already had countries that were going against the trend. Greece, Hungary, Latvia, Luxembourg, Malta, and Portugal. In these countries, public expenditure on health was growing more slowly than the GDP. It is a matter of concern that for the first time in decades, we are witnessing a substantial contraction in healthcare expenditure in some member states. This is not, I must emphasize, this is not the problem in itself. But of course, it is a problem if those countries already had a low level of expenditure in public health to begin with. And I can mention the examples of Latvia, Hungary, and Malta, among others. It is also true that spending more does not necessarily lead to better outcomes, but very low levels or low levels of spending make improving outcomes much more difficult and challenging. That is certainly also a fact. Of course, there are substantial differences between countries, and then I do not wish to generalize. Some could still afford increases, others had to make drastic contractions. But more important is to look at the outcomes. What are we getting in exchange for our money, for our investment? If we look at the outcomes, we can see that over the past decades, the health of the population improved at a very impressive rate. And especially in Europe, this has been nothing short of dramatic. One person born in 1850 could expect to live less than 50 years. Now the life expectancy is close to 80. However, this is the overall statistic. Life expectancy between European countries still varies a great deal, with a gap of 12 years for men, 12 years, and 8 years for women in the highest and lowest performing countries. So these health inequalities persist and need to be addressed in the wider context of public health, but also when reforming health systems. Unlike public spending on pensions, which are solely determined by demographic developments and the institutional setting of the pension scheme, expenditure on healthcare is driven by a complex set of interrelated demand and supply side factors. However, cutting across the board is certainly not the cure for our economic ills. Quite the reverse, as any short-term gains will almost certainly be dwarfed by a greater burden of ill health in the longer term. So we need to look at how we can improve the efficiency in the distribution of our healthcare expenditure. And this means we can, and indeed we should, always look for greater efficiency of the way we deliver care. Let us be very blunt. Many of the current reforms across Europe that were triggered by economic and fiscal constraints have long been overdue in many member states. At the same time, the crisis presented an opportunity to bring about necessary changes that will ensure the overall, or should ensure, the overall sustainability of our health systems, provided we take the right decisions and we take them in time. And this also needs to be to the benefit of future generations. To me, it is a clear lesson learned from this crisis that the countries which had implemented reforms in their health systems prior to the beginning of the crisis were in a better position to face the challenges presented by this difficult period. So there is an important lesson to be learned there. And it's very important because, as hopefully sooner rather than later the worst of the crisis is over, we should very strongly resist the temptation to go back to the business as usual scenario and basically just forget what the problems which led us to this crisis in the first place. Many of the countries more affected by the economic and financial crisis have implemented deep reforms to their health systems with the aim of making them more efficient and more sustainable. In some countries, there was a sense of urgency, severe urgency, which was linked to the economic and fiscal situation, and this led to a very quick implementation of short-term reforms. But it is also now time for the implementation of more structural reforms, looking more at the long term, with the aim of making health systems more modern and responsive. Of course, we understand, and the Commission fully understands, that short-term survival is absolutely necessary, but we should not stop there. We should also now look at a longer-term perspective if we are really to consolidate what we have managed to achieve so far. And also to correct, where necessary, to correct certain effects that the short-term measures may have had. So financial consolidation and structural reform of health systems must go hand in hand to ensure that efficiency gains can guarantee universal access to health services and also to increase the quality of healthcare for the benefit of all. Second important point I would like to make is our health systems must also be responsive. In particular, they must guarantee universal access to high-quality care. A focus on universal access to health services is what I would describe as the cornerstone, the jewel in the crown of Europe's social model. We need to ensure that disadvantaged and vulnerable groups maintain and are able to maintain access to high-quality care, particularly during a crisis like the one we are now facing. And let's not forget that these groups will suffer the effects of the crisis for far longer than the crisis itself. We should note, and this is not a surprise, or it should not be a surprise, that those who are most vulnerable in society are also most vulnerable to bad health. And we still have large disparities in health, which can be found across countries, across regions, between rural and urban areas and neighborhoods. So there is a lot to be done there. Health inequalities are due to differences between population groups, and this is due to a wide range of factors which affect health, living conditions, health-related behaviors, education, occupation and income, healthcare, disease prevention, health promotion services, as well as public policies which influence the quantity, quality, and distribution of these factors. Looking at the basic health indicators, in Europe it becomes clear that a lot of inequalities still exist, as I said before, between EU member states. We can see it, as I said, for life expectancy, but also for other indicators, such as healthy life years at age 65, or indeed for infant mortality. According to the Progress Report on Health Inequalities, which was just published in September of this year, it is encouraging on the one hand to note that for overall life expectancy and infant mortality, we have managed to reduce health inequalities between EU countries. This is positive. However, the continued gaps in health between social groups and between rich and poor, which are confirmed by this report, are still unacceptable. In these areas, we have not made much progress. The current economic crisis now carries the very real risk of further aggravating existing health inequalities and of creating pressure to reduce expenditure, not just on health services, but also on social protection services, which are also essential and maybe sometimes even more essential for these disadvantaged groups. So in these times of economic difficulty, therefore, it is particularly important to step up action to address these gaps, which may indeed grow wider because of the crisis. Equitable and free access to basic services such as health is considered by Europeans as a key driver of equal opportunity, which needs to be maintained and protected. The Commission's policy on health inequality serves to help member states address some of these factors by supporting them in the development of effective policies to protect public health. But to be successful, we need the collaboration, the active collaboration of individuals, stakeholders, and communities. The EU is not alone in this struggle to guarantee access to healthcare while dealing with the sustainability of public finances. This is not just a European problem. As the recent turmoil surrounding the approval of the healthcare program in the US clearly shows, this is a global challenge. The third point I would like to make is that our health systems must be modern. To illustrate this statement, let me illustrate this with some key issues, some examples. We need innovative solutions to deliver better healthcare to more people in a more efficient manner. Clearly, innovation in health must be cost-effective. If it does not help us improve cost-effectiveness, it is of limited utility. So the Commission attaches a great importance to increasing cooperation on health technology assessment as a tool to ensure the development of the best innovation and to avoid duplication of research. For this, both coordination and dialogue are needed at EU level to add value to health systems, to increase efficiency and provide economies of scale and make better use of the expertise we have in Europe. Another area of access to health where coordination could be important or would be important is access to medicines. There is an ongoing discussion on the availability of innovative medicines and pricing. Currently, there are different systems in EU member states for the pricing of medicines. The Commission is of the view that with increased transparency and enhanced cooperation between member states, we would achieve better access of citizens to medicines and help the member states deal with the constraints of their health budgets, also providing greater predictability to the pharmaceutical industry. Smart, and by smart I mean targeted investments in people's health and in European health systems are vital for social prosperity and for the productivity of the labor force. And this demonstrates that investing in health is a key element in the Europe 2020 strategy to achieve smart, sustainable and inclusive growth. Apart from investing in care and cure, we also need to focus on investments in health promotion and disease prevention and giving attention on how patients can help themselves towards a healthier future. We need to give a much stronger focus than we are at present on enabling patients to make better lifestyle choices. High rates of smoking, harmful alcohol use, and poor nutrition all cause poorer health. And a stronger focus on prevention and the early detection and intervention in chronic diseases would have an enormous impact on healthcare spending for the better. It would save on high treatment costs. It would improve health outcomes and increase both the productivity and sustainability of our health systems. Refocusing healthcare systems, therefore, more on long-term prevention can make a major contribution towards addressing the challenges of an aging Europe. I think everybody agrees with this, but the facts show otherwise. At present, only 3% of public healthcare budgets is spent on prevention. And there is even worse news. This proportion is actually shrinking, not increasing. Living longer should also mean for our citizens to enjoy an extension of healthy life years. This is more important than the life expectancy as such. The years we live in good health is what really matters to citizens. Now, also another difficulty in engaging in health reforms is that the results of all these changes, which I have just endorsed, would only be visible years, sometimes decades after they are introduced. And these changes are therefore not always easy to implement. and rarely political cycle friendly, if I could use that term. But they are certainly the right things to do, and therefore an important issue is the issue of political leadership in this process. This is not a process which can just be driven by technical experts. It is also a process which requires, in view of its importance to citizens and the complexity, the best political leadership that Europe can provide. Keeping people healthy and active for longer is, as we all know and we always say, not just good for our society, it is also good for the economy. And there are some real figures which show this abundantly. The healthcare sector is not only a key job creator with about 8% of all workers, but is also a major driver of innovation and technology. Ladies and gentlemen, the examples that I have just presented are not perfect fits for the individual concepts of sustainable, responsive, and modern health systems. Each example could have been used to illustrate any of the concepts, because these concepts are all very much interlinked, and the policies developed for health systems should contribute to all of them. This is a major challenge, but one that it is possible to overcome. Let me finally present you two opportunities that lie in the near future of EU health systems, and both of them, I strongly believe, should be used by the member states to make their health systems more sustainable, modern, and responsive. The first one is the recently adopted directive on patients' rights in cross-border healthcare, a major step forward for patients across the European Union. Under this directive, patients have the option of receiving healthcare abroad and getting reimbursed for it. Patients will have the information they need to make better informed choices, and minimum guarantees will apply to all healthcare delivered in the EU. But very importantly, the directive has also established for the first time permanent formal cooperation between member states as regards health systems, and this is a valuable opportunity. Since 2011, the Commission and the member states have benefited from a firm basis to take forward work on exploiting e-health to its full potential and on pooling our collective resources to improve the way we assess new health technologies. The directive also provides for the creation of European reference networks to encourage the pooling of knowledge in and access to highly specialized healthcare, such as the diagnosis and treatment of rare diseases, just one example. Common rules on the content of prescriptions to be taken abroad by patients have been agreed. I would like to recall that the transposition deadline for this directive was the 25th of October. It's passed. So now it is up to member states to deliver on their obligations, and the Commission will be monitoring their transposition measures very closely. But ultimately, of course, the real impact, the real benefit of the directive will depend on how it is used by patients. And that, in turn, will depend on how well it is understood and used in practice by patients, by health professionals, and within and across health systems. I therefore encourage all the relevant stakeholders to ensure that they are not only fully aware of what the directive does, but also how it is used in their own country. The agreement we reached holds the potential to bring real benefits to all patients across the EU, even to those who decide not to travel and receive healthcare in their own country, because some of the benefits of that directive, such as the minimum standards I referred to previously, will have a benefit also for the vast majority of patients who will continue to opt to receive treatment in their own country. The second opportunity I would like to refer to briefly is the EU structural and investment funds, which can also promote health as an innovative sector, boosting growth and employment opportunities to develop e-health, maintain health infrastructure, and help reduce health inequalities, thus contributing to social and territorial cohesion. The European Commission and individual member states have been engaging in informal discussions on priorities for funding for the period between 2014 and 2020. And we remain very convinced that structural funds can help support member states' key investments in health. But it is vital to seize this opportunity. Health authorities need to work hand in hand with authorities for regional development and also at EU level if they want to use EU structural funds for future investments in health. The next 7 years, which are absolutely crucial because they will shape the future of our health systems for decades to come, should be used by member states to make our health systems more sustainable, modern, and responsive. There is a sense of urgency. And smart investments in health using the instruments we have available at European level can also enhance economic growth. As part of the ongoing reflection process towards modern, responsible and sustainable health systems in the EU, Member States have also conducted a joint exercise exchanging expertise and good practice in order to define the success factors for efficient, high-impact health investment under the EU structural and investment funds. And this is a very useful exercise, the exchange of experience, because there are member states who have been very successful in this and others who can learn from this experience. Ladies and gentlemen, it's clear that health systems also in the EU are going through very significant transformations. In several EU member states, the health systems are under considerable tension and stress, but all of them, irrespective of their situation, must strive to exit the crisis as more modern, more responsive and more sustainable systems at the service of the citizens. In the European Union, the member states are now working together to address these challenges through the reflection process that I mentioned, but also in the EPSCO Council in December, where the Council conclusions will be adopted that will confirm this endeavor to work together. And the Vilnius Health Forum today and tomorrow offers an opportunity for the main stakeholders to contribute to that process. And in this spirit, I very much welcome the declaration from the conference that will support and follow the policy approach that we have ourselves highlighted in our Investing in Health paper. Patients, policymakers, and healthcare providers, we are all partners in this transformation process. Thank you for your attention, and I certainly look forward to our discussions. Thank you.
Martin, you're going to join us here.